How does the sweat test diagnose cystic fibrosis? Imagine a simple test that can reveal a hidden genetic condition by analyzing just a tiny sample of your sweat. That's exactly what the sweat chloride test does for cystic fibrosis. This test measures the amount of chloride, a mineral, in your sweat. People with cystic fibrosis have mutations in the CFTR gene, which affects how their sweat glands work. This disruption causes their sweat to contain much higher levels of chloride, usually 2 to 5 times more than normal. This high chloride level is a key sign that points to cystic fibrosis. The process begins with stimulating a small patch of skin, often on the arm or leg, to produce sweat. A safe, odorless chemical called pilocarpine is applied to the skin, and a mild electrical current is used to help the chemical enter the sweat glands. This method, called pilocarpine ontophoresis, encourages the glands to produce enough sweat for testing. After about 30 minutes, the sweat is collected using filter paper, gauze, or a small plastic coil. The collected sweat is then sent to a lab where its chloride content is measured. Results are interpreted based on the chloride levels found. If the chloride concentration is above 60 millimoles per liter, it strongly suggests cystic fibrosis. Levels below this threshold usually mean the person does not have the condition. Sometimes, intermediate results may require repeating the test or doing additional genetic testing to confirm the diagnosis. The sweat test is safe, painless, and does not involve needles, making it suitable even for newborns as young as 2 days old. If initial sweat collection is insufficient, the test can be repeated to get accurate results. Because cystic fibrosis affects many parts of the body but is most reliably diagnosed through sweat chloride levels, this test remains the gold standard. It is typically performed at specialized centers that follow strict guidelines to ensure accuracy and proper interpretation. The test's simplicity and reliability make it an essential tool for confirming cystic fibrosis, especially after newborn screening or when symptoms suggest the disease. In essence, the sweat test detects high chloride levels caused by CFTR gene mutations that impair sweat gland function. This straightforward test helps doctors confirm whether someone has cystic fibrosis, guiding them toward the best care and management options. Always remember, if you or a loved one are being tested, consulting healthcare professionals is crucial for personalized advice and accurate diagnosis.